Hey guys, Dr. Andy here from Chiro Wellness Centre, and I hope you're having a wonderful Friday. Now today I wanted to talk to you about slipped discs and how do you treat them. Now firstly, a slipped disc is when the soft tissue in between each of these vertebrae pushes out and it impacts those nerves on the side there. In most common slipped discs, it causes pressure on the nerve, so that means you may not get just pain in your back, you'll get pain referred to wherever that nerve goes. Now, it's actually not a slipped disc. It's just a phrase we use to get a better picture for you guys. But what most commonly happens is it either bulges, like so, or prolapses, where it actually squeezes out. They don't actually move, okay? So it looks similar, can you see that? To that. Now, in most cases, doctors will use this phrase slipped disc when the disc is very mildly bulged. However, it's important to understand that a slipped disc can turn into a bad disc bulge or a herniated disc very easily. It's just like when you twist your ankle's weak, and if you do too much, it'll further damage it if you don't treat it properly. Now, in my office, we normally diagnose disc problems from your symptoms, but also examinations, and of course, we need to clearly see it on an MRI or a CT scan. So if you think you've got a slipped disc, it's very important to go to GP or come to us and let's properly diagnose it. Now, you can get slipped disc problems anywhere in your spine. It could be your neck or your lower back, and I recommend you treat them conservatively at first, but you do need to take them seriously. For example, in the lower back, if you get loss of bladder and bowel dysfunction, you might have a condition called cauda equina, and you've got a 6-hour window to get it operated, or you'll permanently lose your problems, or you'll permanently lose function in your lower back. Now, while this is rare, it doesn't matter. Regardless of whether it's mild or severe, you should be taking it very seriously because discs have bad blood supply and take time to heal. Now, in my office, we can quite comfortably treat neck conditions from behind me, but there's a spinal decompression machine that we use. I don't use it, somebody else uses it. It's about $60,000 machines, and it delivers a computerized medical decompression, which will target the disc and relieve disc bulges and pinching. So my go-to referral, if the problem is too bad with you guys, is to send you to one of these places before you consider surgery. Now, some things that might be misdiagnosed could be a degenerative disc, could be a facet syndrome, sciatica, or even spinal stenosis. So, of course, if you're having a look at Dr. Google to see what's causing your pain, please don't diagnose yourself. Get a CT scan or MRI to better diagnose it, because once you better diagnose it, you get better treatment and then better outcomes. So I hope that helps. My name's Dr. Andrew from Chiro Wellness Centre, and I promise you that if I can't fix your disc problems, I'll find somebody who can. Bye for now.